Now showing the sacral portion. The spine comes down and connects to the sacrum, triangular shaped bone right here, and right here is the coccyx. We're going to come down here to a acupuncture cluster of points, which is right above the superior iliac crest of the pelvis. So we're going to come here and we're going to do secret sword right here at these pressure points, and you can't miss this because here's the spine, and then right here, here's the pelvis, and it's going to be, we call it the sciatic nerve clean out, but it's actually a cluster of points. You have bladder 26 and 27 right here, and that's kind of what we call the sciatic nerve clean out. And I can hold my hand in a position like this, similar to secret sword, but my thumb is on the other side, and I can clean this sciatic nerve clean out and come down here to gallbladder 30 and press straight in to the glute, and then I'll take my thumb and come over here to the side of the leg, and I'm just going to hold, and that whole hip is going to release. So you see where my thumb is. It's right there in that trochanter joint, or on the side of it. And again, just going to hold until I feel it release. And when I feel it release, then I can go to my next portion, trident finger position. I'm going to stick that right to the side of the leg, and then I'm going to come from the superior iliac crest. I'm going to come just underneath that, where the glutes attach to. And I'm going to use the same hand position and clean this out. And so now this will release the side of the hip. And I can feel it letting go. And there's a little secret to this. If you're in this lower lumbar region and you're moving around and you feel these little ball-like things, it's lactic acid or a lactic acid buildup in these muscles. And so to get that, you use that trident, and that's what that actually does. Is you stick those fingers to the side here and then here, below the trochanter, on the trochanter, and then above it, 1, 2, and 3, while you're doing the other techniques to do the release of the glutes. And this will release the lactic acid. But you can rub it, massage it all day, and it won't let go. You'll still have those little crusty ball things going on. But if you come over here to these muscles on the side and do the glutes, they will release. And so we want to clean out a section from right at the belt line to just underneath the buttocks right here. Clean out this whole section using the trident. And of course we want to do both sides. And so we come up here to the sacrum, and we can do this same technique here on the sacrum. And we just want to be just on the outside of the bone, but right between the bone and the muscle. Right here, just between the bone and the muscle. Because there's a lot of pressure points here, like a lot of bladder points come through this area. And after that releases, then we just do the next one, and then we do the next one. And so there's a couple different ways you can do this. You can do banding fingers, one side, then do the other. But the basic gist is your areas that you target are going to be this line right here that comes from here to here on the leg. Is going to be right across here on top of the crest of the pelvis, and then it's going to be just over on the other side of the superior iliac crest. It's going to be just underneath that. right there where the glutes hook in, and then you're going to do the sacrum all around the diamond shape or triangle shaped sacrum, and then that's going to take care of all these hip problems in through this area. Now you can come down and there's some bladder points on the back of the leg, and your fingers will just kind of fall right into them. And again, using the trident finger position here, and I've got my hand up here on the sacrum, palm flat like so, and the leg is starting to release, and I'm just going to give it a sweep, just a little sweep to clean out that bladder channel, and now everything feels pretty good. Everything's a lot looser and the hip is released. And so obviously we would do the other side, but of course we're not going to do that for the video, no need for that. So very simple, very easy to do, nothing much to it. Sometimes when you have hip pain, it can go down to the knee and or to the foot. However, we're not going to cover that in this particular video.